Let's review the proper technique for performing a nasopharyngeal aspiration. A nasopharyngeal aspiration is the gold standard for which all other specimen collections are compared to. When properly performed, this can actually be more comfortable than a nasopharyngeal swab and typically induces less coughing and irritation. And certainly in the era of COVID, this is an advantage. To review the procedure for the aspiration with this model, you can see that the catheter goes along the floor of the nose, a quick push and pull, and you're done. Similar to a nasopharyngeal swab, the initial direction is very important. The path of the catheter should go towards the ear lobule and extend towards the back of the nose where resistance is met. 2 to 3 cc's is typically instilled and withdrawn. For nasopharyngeal aspirations, it's very important that the patient is in a supine position with the neck extended. With installation, this allows pooling in the nasopharynx where the viral load is present. The patient is often asked to hold their breath during the aspiration. Once the aspiration is complete, they are asked to swallow any residual fluid. Let's look at the complete technique. The nasopharyngeal aspiration kit can be used for this procedure. This is an NPak kit that comes with all the necessary components. We first want to look at the patient's anatomy to identify if there's a septal deflection or a narrowing on one side more so than the other, and identify which side we would like to go on. We don't want to direct our scope upwards, but more along the floor of the nose towards the lobule of the ear. We then can assemble our kit. The syringe comes pre-filled with saline and the cap can remove with a catheter then inserted. You can expel down to approximately 2 cc's or whichever volume you'd like to use for this aspiration. Lubricant can be used to help the catheter slide to the back part of the nose. There are pre-calibrated markings on this catheter for those not familiar with how far back to go to the nasopharynx. The catheter is then inserted with a quick push and pull with reaspiration of the contents. The catheter is then removed and the syringe is then capped, and this can then act as the specimen container back to the lab